Well, welcome, Julia Rucklidge. Good to have you on the podcast again, and congratulations on your new book, The Better Brain. It's a great read.
Great. Well, thanks, Grant. It's always a pleasure to talk with you and chat with you about this area of research. I'm thrilled to be here.
So tell us about the treatment gap.
I think about the treatment gap as those number of people who are currently not receiving any treatment, but who struggle with a mental health issue. And we know in New Zealand, that's a really big problem. And it's, only 3% of the population have access to mental health services. You have to be in the severe range in order to be able to get into the clinics, into the public health system. If you're mild, even moderate, you're getting turned away. I read stories about kids who are not suicidal enough in order to get into the services. So we know this is a huge problem, and it's got to do with having a lack of professionals to adequately address the mental health issues that are present in New Zealand. There's just not enough of them.
That's true worldwide.
Yeah, absolutely. Yeah, that's not good. Because if you think about the numbers, this number that gets thrown around, it's about 20%. 1 in 5 of us is struggling with a mental health issue. That kind of depends on how you want to define it. I think everybody struggles to some extent at some point in their life with a mental health issue. Do you need to see professional services? Not necessarily, but to sort of acknowledge that struggling with depression, struggling with anxiety can be a normal part of life. We don't have to pathologize it. And it's funny how with physical health, we're okay with everybody is going to, needs to look after their physical health. And, we all need to look after our heart health, and we need to make sure that we're eating adequately to ensure that we don't go down a path of, say, type 2 diabetes, et cetera. But we just don't think about that in terms of mental health. We seem to think that that's reserved for a certain part of the population.
I just want to touch on, this is around, I guess, psychiatry and medicines and medications. If I look at our best practice guidelines in this country, and it's got quite specific, clear guidelines about the treatment for mild or moderate depression, and even for major depressive disorder. And it's very clear that medicines for mild or moderate should never be the first line treatment.
Though.
Quite clearly and specifically lists out a range of evidence-based therapies which start with exercise and physical activity. It mentions nutrition and diet. It mentions sleep. It mentions talk therapies and connecting with other people.
But we don't have enough professionals. That's
right. But we don't
have.
But even if we don't have the infrastructure, even within the professionals that we have, right?
Well, we don't have the infrastructure. There's no way. I train in a clinical psychology program, and we have, over the time I've been here, we have doubled the number of students. We've gone from 8 to 16 now. And we are seriously struggling with training 16 clinical psychologists per year because we don't have the internships. We don't have the placements for them. We don't have enough staff to be able to one-on-one monitor them and supervise them, which is essential for them to get that expertise in conducting cognitive behavior therapy. So we have a model that requires an enormous amount of investment to train them and an enormous amount of time for them to get through. And so you have a bottleneck in the terms of the number of psychologists you can ever graduate in 1 year. So when they say we just need more of them and that's the solution, goodness, you need to do a fairly major more of them, like double, triple the workforce, and still you're not going to adequately get that hit that 20%. So we've got a model that, yes, it's ideal, perhaps, although one might argue that still only 50% of people get better with psychotherapy. So you've got this model where we're expecting a really intense level of training, and you will never be able to get the number of people needed to adequately to be able to service that 20% of the population, and it's not achievable, and nor is it it's something that our country can afford. So that's why I think the Better Brain kind of it presents a really different way of thinking about mental health to say one of the factors and risk factors that is being really emerging over the last decade is our nutritional foundation. It's just been eroded because of this social experiment of eating ultra processed foods. So if we could just address, really tackle that, which maybe that's harder than training more psychologists. I don't know.
Well, the solution I've been thinking about is in this health coaching and
Yeah.
sort of mental health coaching and community health workers, which is a workforce, and we in Leicester, New Zealand, and I know it's happening in other countries as well. We see these health improvement practitioners who have some training, and there seems to be some evidence that they're achieving something without the level of training of a clinical psychologist, but certainly interacting and being overseen by.
Yeah, and we need that. We need that.